Hi, and welcome to Dr. Brainwaves. We are back, and today we're going to talk about a common problem. It is called the cough. And I'm not talking about like a cold for a week or two. I'm not talking about a cough related to an irritating substance temporarily. I'm talking about
taking a drink
cough.
of water, it goes down the wrong pipe, and you start coughing. Yeah, that's not working.
We're talking about a cough that you've had for a while, and it's annoying. We're going to talk about when you go to your doctor with that and why you go to your doctor with that.
That's right. So cough is a very common problem that is frequently presented to primary care doctors. And you'll see that in a non-smoker, the three most common causes of cough, number one is going to be postnasal drainage. Makes sense, doesn't it? If you've got drainage in the back of the throat, it can cause you to cough. The second most common cause in a non-smoker, particularly in pediatric population, is going to be asthma. And the third most common is going to be gastroesophageal reflux disease. So cough is typically a normal response of your body to try and expel something that shouldn't be there. Just like we mentioned, if you drink something that goes down the wrong pipe, your body is sending up signals to say, get it out, so then you're coughing and trying to expectorate or just get it out of your system. So that is a natural response. But if you've had symptoms that are prolonged, then it can be an issue. And those are the things that we need to address. So when it comes to postnasal drip, that can be due to, we talked about this before, rhinitis, which just remember is inflammation or swelling of the nasal mucosa. And if you have postnasal drainage from that, it could be a sinus infection, so an infectious etiology or an infectious cause can do it, and that can be viral or bacterial. Another thing that can do that, if you have postnasal drainage because of allergies, and you know that the cough occurs during seasons, especially when the pollen is elevated, or when you go into a home and there are animals that you're allergic to, and it causes you to have that postnasal drip and you start to cough. Other things will be associated with not just rhinitis and not just swelling of the tissue in your nose, but other things. And so let's go down a little bit deeper into the lungs now. So when it comes to the lungs, asthma is a common cause of cough. Now, people who smoke will also cough. In fact, there is a condition called chronic bronchitis. So if a person coughs for 3 months in a row, for 2 years in a row, they are designated as chronic bronchitis, and it's because of this cough. And you can usually hear it sounds a little bit juicy when they cough. Typically with asthma, it's going to be a dry cough. And some people won't have the other common symptoms because there are several common symptoms of asthma. There's cough, wheeze, shortness of breath, chest tightness. In some people, they may only have a cough. In fact, 15% of children will only cough as their asthma equivalent. That is their asthma symptom. And some people, again, just have a cough. And so it makes it difficult to try and tease out what's going on. But a dry cough, especially a cough in the middle of the night, is more suggestive of asthma. And then the third most common cause is going to be gastroesophageal reflux, which is very interesting, and the exact mechanism of action has not been well defined, but we think that there are two reasons for it. One is because the gastric contents, which is in the esophagus, migrates up into the esophagus and can stimulate receptors, and those receptors can transmit signals to the sinuses and cause postnasal drip from reflux. Or another explanation is the reflux itself, in other words, the gastric contents can actually pool in the back of the throat and cause cough. So cough is unfortunately a common condition. And when do you see somebody for that condition? If it is troublesome. So if you can't do an activity without coughing, and for an example, with asthma, if you go out, if you're a runner and you run outside and you start coughing, and you're outside running, particularly if it's cold outside, it suggests that they may have exercise-induced bronchospasm or a trigger of asthma, which is common when it comes to cold air and exercise. It's a common symptom. Again, if a person just has a cough, then you can narrow down your diagnosis a little bit, but it still should be identified, and going to seek medical intervention is extremely helpful, especially when it comes to asthma. There's literature that's shown that if there is a 2-year delay in the diagnosis and treatment of asthma, it can cause irreversible lung disease. So time is important. The timing is important. So if there is a question, you definitely want to have that looked at. When it comes to postnasal drainage, again, it's nice to be able to distinguish whether or not the postnasal drainage is coming from here, up here, or whether or not it's coming from below and up.
So do you think it's a reasonable approach for somebody who's had maybe a cough of several months duration and doesn't have other big health issues at hand, which you might want to touch on, as you kind of mentioned with the smoking and bronchitis, etc. But in an otherwise healthy person with a new onset of cough, since the three top causes are firstly postnasal drip, secondly asthma, and thirdly reflux, would it be reasonable for them to try one of these medications for postnasal drip over the counter, and maybe even an anti-acid medication to see if they get some resolution of their symptoms?
So all great suggestions, because what you can do is your own diagnosis or try to do some things at home. So when it comes to postnasal drip, one of the things that you can try to do is try and identify your trigger, eliminate it, or avoid it as much as possible. If you see significant improvement, also watch to see when your symptoms are, because if your symptoms, again, are clearly associated with an increase in pollen, or when you're exposed to animals, or when you are in a room that has a lot of mold, if you're having symptoms at that time, the cough is more common or more frequent at that time, then it suggests allergies, or it suggests an irritant. So you can use the nasal spray. You can use an antihistamine. You can use some of those natural substances, some of those herbal medications, the butterbur and some other things, or essential oils. So those things you can use.
So if it is from postnasal drip, it's a reasonable thing to try something to get symptomatic relief from your either allergies or irritants with some mild over-the-counter medications. And if that doesn't work, present to your doctor.
Absolutely.
How about reflux medications?
So if you try those medicines and you don't get good relief, or you want to dig a little deeper to find out what the true culprit is, to see if this is allergy or otherwise, then you want to seek the expertise of your allergist, who might be able to do a diagnosis, do a series of tests to see what it is that's causing the symptoms, so that you can really get to the root of the issue. And that's one of the things that Dr. Azar and I feel very strongly about, is not just putting a band-aid on the sore, but really trying to identify what the root cause is and going with that. Now, when it comes to reflux, one of the things that I try to do is not use a lot of pharmacologic therapy at that time. So I will frequently suggest to patients, even if they have postnasal drip and they do have symptoms of reflux, but the problem is lots of people have silent reflux. And that can create issues because they don't have the obvious symptoms of burping, or when they throw up, when they burp, they throw up in their mouth, or they have the acid indigestion, or something we call acid brash, where you can actually taste the acidity in your mouth. So some people don't have those symptoms, but they still have reflux. So frequently I will have them doing some non-pharmacologic things, in other words, precautions. And some of those precautions would include elevating the head of your bed. And what I tell people is just don't sleep on 3 pillows, because most people, when they go to sleep, they don't just stay in the same position, wake up in the same position that they started out in. So I tell them, put something underneath the mattress. And now they have these sleep number beds and other things where they can actually control it and elevate it. Usually 25 degrees is about right. I tell people 6 to 8 inches is fine. So they can do that. The other thing is no eating 2 hours before you go to sleep at night. Now, the reason to elevate the bed is because we want gravity to keep all the gastric substances where it needs to be, in the stomach and down, but not into the esophagus or the swallowing tube. The other thing is going to be no eating 2 hours before you go to sleep at night. And the reason for that is because we want the tummy nice and empty. We don't want there to be a lot of food in there, because it's more likely to migrate up than it is just to sit there and do nothing. So we recommend that, don't eat anything 2 hours before you go to sleep at night. And the third thing is that there are lots of things that can trigger reflux. And so one of the things that can do that are foods. So the recommendation is not to eat, or I tell people, do a 2-week avoidance of tomato-based foods, chocolate, caffeine, fried foods, tobacco, alcohol. So those are some of the things citrusy foods can do too. So those are some of the foods that can trigger reflux. Now, truthfully, you may not have problems with any of those foods. So then you can go back to eating them. And if you do, and then you start having that cough back again, well, guess what? You probably do have some silent reflux. So those are some of the things, but the big thing, and if you have reflux that goes on for a period of time, it can cause problems down the road. And that's the reason why it's recommended. I recommend that you have it evaluated, but moreover, that you really focus on doing some things So you don't have to take a lot of medicines for it, because although antacids, Tums, those medicines have been shown to be effective, some other group of medicines, they're called PPIs, proton pump inhibitors, have been fraught with some side effects that we didn't know were there when we first started using them. And one of those is osteoporosis, but it can also cause other problems. So I prefer that people use some of those precautions or some alternative medications or alternative therapies. And then when it comes, let's get back to asthma for a second. So again, asthma can present as just a cough, but there are other conditions that can present with a cough. So some people, as I mentioned, smokers, for an example, they may also cough. And what they will come in, and frequently patients will come in and tell me that they have asthma, but they have been smoking for the last 40 years, or they smoke 2 packs a day for the last 20 years. So that probably is not asthma that's caused them to have the cough, and that's where diagnostic testing, breathing tests are going to be extremely helpful to try and distinguish one from the other. And the reason being is because the medications can be different when we treat COPD or emphysema versus asthma. Now, truthfully, many of the medicines are the same, but at what point you start those medicines can be extremely different.
And there may be some other more serious underlying issues that can cause a cough, such as fluid in the lungs, as an example of a complication from a heart failure or a tumor in the lungs. There are some very serious underlying issues, and that's why if you have a chronic cough and it's not responding to the measures that Dr. Seuss is talking about, you're going to need to get evaluated.
That's right. And if someone, and again, that's why the history is so critical, because someone comes in my office and they've had a history of cancer. Well, again, depending on where the cancer is, but really one of the first steps that we may take is getting an imaging study or a chest x-ray to see if there is anything going on in their lungs. And typically, as Dr. Azar was saying, that you will see fluid. You can easily see fluid in the lungs. You can't always easily see a tumor in the lung, but that will also be looked at. So it's not uncommon if you have a cough to have an extensive evaluation that includes a chest x-ray as well as another type of imaging study that we call a CT scan of the lungs to give us a better idea. Because cardiac issues or heart issues certainly can present with a cough. Foreign body can present with a cough, as well as cancer can do it, and other conditions of the lungs and heart. Sarcoidosis is another condition. And then there are infectious issues that can also present as a cough. So if someone has pneumonia, for an example, it can present as a cough. Now, typically there's going to be other symptoms associated with that. Typically, if a person has pneumonia, they're going to have an elevated temperature, which will help gear you. If someone has had a history of open heart surgery, for an example, you're going to be more concerned about their heart and something else that may be going on. But again, going to a provider who you trust, who is an incredibly good diagnostician, will help tease out those different things to see which one they should focus on and at what time. So obviously, if someone has asthma, if they have a tumor in their lung, if they have what we call pulmonary effusions, which is fluid in the lungs, those things are critical and should be treated immediately.
But as Dr. Seuss said, there are some troubleshooting measures that you can take at home.
Absolutely.
Keeping in mind that if you're otherwise healthy and you have a relatively new onset of a cough, you can try troubleshooting pretty easily at home for reflux, which is the number 3 cause, for post-nasal drip, which is the number 1 cause, and giving some consideration to those other things, including asthma.
And again, those 3 common things are in non-smokers. So then we have a whole new or whole different differential diagnosis for people who are smokers.
Thank you for your time, and we hope you're enjoying Doctor's
Brainwaves. See you soon.